There are 20,012 confirmed cases of coronavirus in aggregate since the beginning of the pandemic in Victoria. That's 45 new cases since yesterday's update. 32 of those 45 are linked to known outbreaks and complex cases. 13 of those are under investigation. 3 cases were reclassified. There have been, I'm sad to report, now 750 Victorians die as a result of this global pandemic, 5 more since my last report. 1 male in their 50s, 1 male in their 70s, 1 male in their 80s, 2 females in their 90s. All of those deaths are linked to aged care. Again, we send our sympathies and condolences to each of those 5 families. There are 90 Victorians in hospital. 11 of those are in intensive care and 7 of those 11 are on a ventilator. A total of 2,551,044 test results have been received, which is an increase of some 15,910 test results since yesterday. Again, we thank each and every one of those people for coming forward and getting tested. We again urge all Victorians, no matter how mild your symptoms, as soon as the symptoms are noticeable to you, then please go and get tested. Don't wait a day, don't wait 2 days, don't wait till Monday if it's on a weekend when you begin to feel unwell. Please come forward and get tested. More than 200 sites, a 90+% turnaround within 1 day. It's a massive contribution so that we've got the certainty and the clarity so that we can ease these rules, so that we can take these safe and steady steps. We don't want to have opening up in any way limited by a less than complete picture, by test numbers that are too low for us to have confidence that we know how much virus is out there. It's a simple thing, but it makes a massive difference. Each and every Victorian, even mild symptoms, as soon as you feel those symptoms, come forward and get tested. It's absolutely critical to opening and indeed to staying open in those safe and steady steps. 4,272 cases with an unknown source, no change since yesterday's report. 140 healthcare workers who are active cases. We wish them well. We thank them and their colleagues for all the amazing work that they do every day. There are now 920 active cases in Victoria. They continue to fall, and that is very pleasing news. The rolling average for September to 17 September, Metro 42.7 cases, regional 2.3 cases. Across the state, therefore, it is 45.5. In terms of regional metro split, there are 30 active cases in regional local government areas, and there have been just 1 new case in regional Victoria, which I believe is in that Geelong corridor. Active cases in disability facilities, we're now down to just 1 active case in those settings. That is a staff member, very important given the vulnerabilities in those settings. Aged care, there are 474 active cases in aged care. Those numbers continue to come down, but we do know that it's a real challenge, and whilst I'll leave announcements out of National Cabinet to the Chair of National Cabinet, to the PM, who I'm sure will be up later on today, part of our discussions today were about the inherent vulnerabilities in aged care and the need to make sure that every single provider, every single facility is vigilant, not just for the next few days or weeks, but indeed all of those steps that we have taken need to be just the new normal for aged care settings well into 2021. Right up until a vaccine arrives, we're going to have to continue to be extra vigilant. So private operators, staff, all of us having to work together to make sure that we keep aged care residents safe and the virus out of aged care, doing everything we can, and that we'll have more to say about some additional measures that we can put into place in aged care in due course. That is really all I wanted to go to today.